Well, it is said that sex penetrates the whole person and sexual constitution is a part of man's general constitution. Hence, there is a considerable truth in the dictum, a man is what his sex is and a woman is what her sex is. In my experience of seeing more than 55,000 cases, I don't think anybody in the world must have seen this number of cases, because that's the only department of sexual medicine in the country. Majority of the problems which I have come across, majority of the clients who came to me, I have found one thing in common, that there is tremendous anxiety over a sexual situation, which is usually brought about by the negative feelings, which gets into conflict with the experience of failure. The failure recurs, anxiety increases, and a vicious cycle is set up in which hostility, shame, guilt and fear become the part of the pattern of any potency problem, whether it is psychological or organic. Unlike West, this particular anxiety in our country and in Southeast Asia, I would say, is born out of myths and misconceptions and misdirections about sex and sexuality. By this particular channel or this particular talk, what I am going to do, my aim would be to demystify these myths, make people more comfortable about their own sex and sexuality, at the same time offer them simple solutions of their problems. I'll just give you a simple example. I did my undergraduates and postgraduate workshops with Masters and Johnson in 1973 and 75. I'd been even to Kaplan's Institute just to see what they are doing. I am a certified sex therapist in USA, but history taking what they are doing is, I found it not very well structured and very long. We have developed a new sort of a simple method to evaluate the clients. We ask just 4 questions to the male and 4 to the female, and we come to the effective diagnosis. I ask the men desire, erection, penetration and orgasm in men. Similarly, in female, desire, lubrication, penetration and orgasm. We consider it that the ejaculation in men and vaginal contractions in the female are the dispensable pelvic physiological concomitants, and they are not necessary for the human sexual response cycle. Especially the emphasis is the orgasm is between the 2 ears and not between the 2 legs. Suppose if an individual is reaching orgasm early, we call it early orgasm. If it is little late, we call it delayed orgasm. I don't use the word, we don't use the word retarded ejaculation or premature ejaculation for early orgasm. The moment you say premature ejaculation, you are propagating a myth that ejaculation and orgasm are synonymous. In reality, they are distinctly different and one could occur without the other. Same way, if a man is reaching orgasm with a delay, the entire world calls it as retarded ejaculation. Can ejaculation ever be retarded? It's a retarded thought. We need to change. We use simple delayed orgasm. If the orgasm there is less pleasure, we call it impaired orgasm. If there is no pleasure at all, we call it absent orgasm. And this is the only classification in the world which has male and female parallelism. So the misconceptions are not only among the non-medical fraternity, they are also among the medical fraternity. So we thought that this would help us demystify the myths, give an idea for a proper diagnosis globally so that they can treat the cases very well. Say for example, if a man reaches orgasm early and if his prostate has been removed, or he is taking medicine like carbamazepine or tamsulosin, which sometimes lead to no ejaculation at all. So man reaches orgasm, but there is no ejaculation. If he reaches orgasm early, still you will call it premature ejaculation, despite there is no ejaculation, which is a paradox. The entire scientific community is rolled up in myths and misconceptions. So we plan to offer more clarity to the people in general and scientific community in particular.